And thank you. Looks like we have folks kind of settling in. The numbers are stabilizing. So good morning. Welcome to office hours. Um, really excited to have you all back with us this week. Hopefully you had some time to think about the discussion that we had last week and come prepared with some questions. We know that we got some questions in advance too. I also want to say thank you to our colleagues who were able to join us this week from HMA and have come back to talk about some of their work with Matt and Jails. And we also have Cassandra Costa from Imperial County. Thank you so much, Cassandra, for coming back. I know some of our presenters from last week were unable to join us today. Sadly, the Sacramento team is not able to be here, but we do appreciate our other county partners coming to listen to the conversation, but also in case y'all had follow-up questions when we didn't really get the chance last time to go through all of the Q&A. We also have some other internal subject matter experts from here at DHCS who will be here to help answer questions that you may have around the behavioral health pieces. And so we tried to bring the right people to the table to answer your questions. We'll do our best to answer as many questions as we can today. We do have a document that we're going to share out in the chat and we'll send out following today's meeting to everybody who participated today, but also to everybody who participated last week. This includes follow-ups from last week's conversation with questions that were put in the Q&A, making sure that everybody's getting answers to the questions that folks are posing during these meetings. So we'll be sharing that out both in the chat with folks today and via email following today's session. In that document, what you'll see are questions ranging from a variety of topics, not just the things that we talked about last week, but some specific topics around behavioral health and the provision of behavioral health links and MAT treatment, billing codes. There's also some questions around just the timeline overall for this initiative. And we'll continue to share out questions that we're getting from these meetings so that everybody is getting access to all of the same information. Like we've done before, you are encouraged to put your questions in writing via the Q&A function. This is also open forum, so you can raise your hand and ask your questions live, and we'll try to answer as many as we can during today's session. I do also want to remind folks before we jump in to questions more broadly that this particular session is meant for our county partners and not meant for providers and advocates and other organizations. There will be a general office hours session next week where everybody can come and ask your questions. But this session is really meant to be a space for our county correctional facility partners, county entities that are implementing the correctional healthcare services, or county behavioral health agencies to be able to ask questions. Particularly around last week's topic of behavioral health services as part of the pre-release package, but could be about anything. And this space is really meant to be an open forum for all of you. So I think with that, we'll jump right in and give space for you all. So I don't know if we have any brave souls who want to get us kicked off with questions, but that's why we're here, is to make ourselves available and help answer questions that you might have. So you can raise your hand if you do have questions using the React panel. If you open that up where the little heart at the bottom where it says React, you can raise your hand and we'll call on you. And you can also pop your questions in the chat. So I see the first hand up from sorry, I don't know how to say your name.
Jen?
Sen?
Yes.
Jen? from
Hi.
CalOIM Health, also
Yeah,
not a county, I notice, but
yeah. Sorry. I was trying to ask this question, but in a different session, but I wasn't able to join. But um, so I'm with a MCP, and a couple of questions came up internally, trying to figure out how we're going to coordinate um, for CalAIM services that are covered by the MCP in the pre-release period. So one of the questions that came up was, will those JIA codes be transmitted to the MCPs as soon as they're activated during the pre-release period, so we can plan for some kind of workaround in our system to make them somehow ready to make appointments or authorizations at the time of their release. And then separately, for members who just signed up during the pre-release period and therefore are not assigned to an MCP, so therefore when they leave the correctional facility, their fee for service with DHCS, what suggestions do you all have for coordinating services that are covered by the MCP? Thank you.
thank you. I will answer your question, but I do want to remind folks that this session is for our county partners. And next week is our general session. So all of our plan partners can come and ask questions next week. We'll answer these questions today, but as a reminder, we want to keep space for our county partners in this particular session. The plan for the aid codes is when the aid code is activated in the JI screening portal, that will also trigger the kind of back end auto assignment process. So if a member is not enrolled in a plan prior to incarceration, that would trigger the assignment into the plan so that they're included, in the plan's membership on the day of release. And there would be a process for notifying plans about that. If the member is previously enrolled in a plan, then they would be reactivated with that plan as part of this process. And then all members will have choice once they leave the correctional facility setting. But there is some infrastructure set up to ensure there's the coordination. But there's also, by the way, the ECM coordination that will happen to get folks connected to an ECM provider, and all of the plans are required to have a JI liaison who and the correctional facilities will contact the JI liaison to get the member connected to an ECM provider, including in terms of like short-term stays, notifying the plans that a member has been released. And there's all of that is kind of laid out in our policy and operations guide. But we're also going to talk about kind of the handoffs and care management functions in one of our upcoming sessions. The next session will focus on clinical physical health services, and then the session following that, which is currently scheduled for November 14th, will be specifically focused on the enhanced care management and kind of coordination with the plans pieces, and that'll be on November 14th. So more to come on that. All right, let's go with Nicole from El Dorado County.
Thank you. So my question is about county behavioral health linkage responsibility. So not providing services in the jail and the correction facility as an in-reach or embedded provider. My question is for us as behavioral health division when we are doing the care coordination and the behavioral health linkage. But for example, our county correctional facilities haven't gone live yet. Are we already able, because we do the linkage now, are we already able to then claim for our care coordination while the individual is in our correctional facility? Or can we only do that if we are collaborating with a correction facility that has gone live?
It's a good question. We have gotten those questions recently, and I think that we're looking at that. We're looking at that about like what happens if you've gotten the link, but the county is not yet live with the pre-release services. By the way, if they're not live, then the JI aid code won't be activated. And so while the member's incarcerated, they're not eligible unless the aid code is activated. So it's a bit complicated. But we have recently received that question and will provide guidance back to county behavioral health agencies about that.
Great, I appreciate that. Thank you, because that's exactly what I thought. They don't have the individual, the member doesn't have the JI code yet gone live. So yeah, appreciate for having that guidance coming towards the counties. Thank you.
Yeah, no problem. And then just as a reminder, I'll put up just really quickly the slide that we previously shared in the same direction as going to the behavioral health directors today, but we had shared out kind of expectations of what go live would look like for the county behavioral health agency, which was required to be active as of Tuesday of this week. So if the county correctional facility in your county is not live with pre-release services, but you're the county of responsibility, you would still receive behavioral health links from other counties or state entities when CDCR goes live, but also cover post-release specialty mental health services, drug Medi-Cal or DMC ODS, ensure that you have an adequate network, and collaborate with the county correctional facility to plan for go live. I think your question would fit into this category if we have a path to move forward with that. At this point, we don't know what the answer to that is, but then of course, once the correctional facility does go live, you would receive the link from that county as well, and then provide the pre-release in-reach services, as well as all of the other things. So this is the kind of information that we previously shared and what will be going out today to the behavioral health directors as a kind of reminder of your obligations. There's also a behavioral health information notice with other specific information about that county behavioral health agency's responsibilities. Thank you. Okay, Cynthia Harlow.
Hi, my question has to do with contracting for services and if in compliance with the CFR 200, what documentation we're going to need, and if there are finance department contacts we should be working with.
I can't actually understand your question. It's a little muffled. Can you maybe try again? I don't know if anybody else can hear, but I'm having a hard time distinguishing what you're saying.
It's about compliance with the CFR 200, and is there a finance department contact we should be working with to ensure we have the appropriate documentation that we're going to need for contracting out services?
So I think you're asking, I don't know the first part of your question to complete like an answer, but asked about contact information for finance department. So you have all of the documentation you need to pay out claims. Is that what you're asking?
Right. So with the CFR
Thank you.
200, there are certain things that you have to go out to bid for or have sole source documentation. So I was wondering if there's a contact within PCG or the finance department that we should be working with on that documentation.
Team, anybody from our team at DHCS tracking this question?
Hey, Autumn, this is Michael. No, we are not tracking this question, and we'll need to take it back.
Well, Cynthia, we'll follow up with you.
Okay, thank you.
Okay. Seth Stabinski.
Hi. So my question is about, and probably maybe all the billing people understand this already, and I'm asking a silly question, but on the aid codes, I didn't really understand. So there's I2, I3, I4, I5, I6, And they have different, they've got one, the first one is 90-day pre-release Affordable Care Act, and then there's pre-release services Title 19, and then there's pre-release services Title 21, and pre-release state only, and then the final one is pre-release unsatisfactory immigration status. I don't really understand what as a jail we should be doing for our that code.
Right. So I don't know if anybody from our eligibility division is on to give you a better answer. Sarah, you happen to be on here today? If you are, please feel free to jump in, or William or somebody from eligibility. But basically the different kind of aid codes tie back to federal eligibility. So once they're activated, like for example, the last couple or the last one that you stated about unsatisfactory immigration status, we pay those claims with state only funding and do not pay those claims using federal funding. So it's a way to distinguish eligibility based on the immigration status of the individual. And so it depends on like if that person is in one of those specific kind of aid code categories. I believe that there are instructions about that that we can make sure. Oh, there's William. I see you just came on camera, and you want to help me out here?
Yeah, sorry. No, what you said was entirely accurate. The different aid codes are broken down by funding. So CHIP aid code, 100% state, as Autumn indicated. And we do have aid code descriptions and instructions that are part of our meds manual. So I can look for that information and get it to you.
Okay,
we should get it out probably to the whole group. And I think part of the question, William, is like, how do they pick which is the right aid code? Or I don't actually know if that's how that works. So
so the aid codes would be assigned by the county that adjudicates the application.
Social services.
Yeah, social services side. So the jail facilities, the probation facilities wouldn't be involved in that process. When you submit the Medi-Cal application, the county will adjudicate the appropriate aid code status and the secondary aid code for JI.
Perfect. Thank you. That answered it for me. Thanks.
And then Autumn, I'll get that list over to your team. Send it to the group.
And thanks for jumping on and being available to answer. I'm glad I got it mostly right. But yeah, thank you. All right, Gail Haberman.
Hi, I'm with the Department of Mental Health for LA County. And in our youth correctional facilities, we're working with our probation department right now to come up with the best workflow for screening for Medi-Cal eligibility. And we have a question about what the state considers Medi-Cal, a person to be Medi-Cal eligible. So if a youth comes in and at intake, they say, we're not on Medi-Cal, but we'd like, sorry, it sounds like I'm echoing.
I sound okay.
Okay.
Yeah.
Okay. So if they say that they want to be enrolled in Medi-Cal, it takes 4 to 6 weeks to actually get that enrollment secured. So for us to activate the JI code for them, is it okay with you just the fact that we've submitted an application, an enrollment application for Medi-Cal? Does that qualify us to turn on the JI code?
There's actually, so as part of the requirements that went live in January of 2023 around the pre-release Medi-Cal application process, there's our eligibility division, and I saw William came back on camera, so I'll turn it over to him in just a second, but there is guidance around kind of more of an expedited review of applications for people who are incarcerated. It should not take 4 to 6 weeks. It should be a much faster process than that, so that the county social services department is making the eligibility determination, that they're coordinating with the county jail or youth correctional facility to communicate information about the application status in much more I don't know if real time is the right way to describe that, but in an expedited process. I know some counties, for example, are setting up like an API interface that allows the systems to be able to communicate to each other between the jail and the social services department. I'll turn it over to William for a more specific answer, but generally, like, there's considerations and policy to address the concerns that you're raising here.
Yeah, and one of the things that our division under our JI team maintains is a contact list for the JI sort of subject matter experts at the county social services departments. And that's a great sort of first way to escalate an application that is on a short timeline, because they can look at like prioritizing that in the workflow at the county level. The other option that we do have available for sort of cases that fall more into an immediate need category is it is possible to submit an application through the CalHERS portal, which is more commonly known as Covered California, and that will also evaluate for Medi-Cal in real time. And that also provides the fastest path to what we refer to as accelerated enrollment, which will provide essentially temporary Medi-Cal to individuals until the application has been adjudicated, as long as they attest to income, which is within sort of the normally acceptable Medi-Cal threshold. And that can be conferred within a matter of hours.
Thank you for that. So, so just to follow up, like, what do you consider that we're like, for you, at what point can we activate the JI code in that scenario? Like, do we need confirmation?
What the hell is going on?
Good question.
So the portal will actually not accept, the portal is programmed to query for medical eligibility and meds before it activates benefits. So I believe that, you know, the answer there may be simply if you try and you get a negative response, you'll know that it's not at a point yet where benefits have been posted to meds. And that's ultimately the sort of cutoff for being able to provide services from the portal standpoint is, you know, can you receive an acceptable positive response in the system?
Okay, so we'll need to, thank you. We'll need to go back and work with our DPSS and probation partners to understand this accelerated route. One more just follow-up question on that is, can we bill for services for any eligible service that happens the same day? So let's just say a youth comes in and right away we do a physical screening and a behavioral health screening, like within the first 8 hours. If we actually activate the JI code at the end of the day, but those medical and behavioral health screenings have taken place before chronologically, can we still bill for those?
So generally speaking, aid codes are retroactive, but I will defer the ultimate answer to Autumn because billing is not quite our subject matter area.
Yeah, I think it's I think there is already guidance about that in terms of the activation of the aid code back to the month in which, you know, the first of the month in which eligibility was determined, or whatever the normal rule there is, William. So
yeah,
I think that's
first of the month, and then you can go retroactive up to 90 days on the primary aid code, but that's usually for outside services.
I think that we'll confirm, but I think that we are aligning with that policy, but we can confirm that. Okay. Seth Stabinski, I see your hand up again.
Yeah, thanks. A couple weeks ago, there was a California State Sheriff's Association meeting, and DHCS presented, and it was for fiscal people. And some of my fiscal people came back and were confused by something that was said. And I just want to confirm that there's still a plan that the billing, again, it sounds like maybe this isn't a billing session, but I just want to make sure that nothing's changed in terms of the fact that, for example, our jail, we're planning on doing I'm working now on establishing the jail. We've got an NPI number and establishing us as a unlicensed clinic. And we're planning on doing all the billing, even though we're a WellPath count, we have WellPath in the jail. We're planning on all the billing being under our jail NPI number. The fiscal people came back and said they heard that it was okay for WellPath to be using WellPath's NPI number for that work. And I just want to make sure that hasn't changed in any way, because that's obviously a major feature.
Billing is supposed to be under the correctional facilities NPI number, whatever county entity is responsible for county correctional healthcare services. So whichever entity that you contract with should be billed under their NPI number. But you can do it on their behalf as like a billing entity, like a third-party billing entity, but it should be billed under their NPI number.
Okay. That one still didn't quite make me understand. My understanding is that, for example, if you have a contract with not a county agency, but if you have a contract with a county, I'm sorry, with a private entity like a WellPath, a NAFCare, those sorts of entities, the billing for the care that we have a contract with them to deliver healthcare, but that they're not supposed to be using, like their providers individually, their providers would have NPI numbers listed under our jail NPI number, our unlicensed jail clinic
Exempt from
jail
licensure
NPI
clinic.
number. What's that?
As an exempt from licensure clinic.
Yeah. And so that they would all, once we get our exempt from licensure clinic status, I'm working right now with Medi-Cal, who's, by the way, been very helpful with DHCS to help us get through that process. But as soon as we get as soon as we are a exempt from licensure clinic, my plan was to take all the WellPath people's NPI numbers and put them under that clinic, and then the global billing would be done under the jail's NPI number. And I thought that that was a requirement that the correctional facilities have to bill under a correctional facility, so that checks and that sort of thing are coming to the county or to the jail and not necessarily to the private entity that they've contracted with.
That is correct. It has to be billed under the jail's NPI number.
Okay. All right. Thank you. Sorry if I made anything confusing, but they came back with something that it sounded like they were confused about it because it's been such a basic thing, and it's been part of the process since the very beginning, that I wanted to just make sure that's the way.
Yeah. So the way it would work is the county entity. So I know you guys work with many counties, but the county entity would be the enrolled entity. They would be the ones that you could submit claims on their behalf, but it would be under the jail NPI number. The claims would be processed and funds reimbursed to the county entity, and then they pay you in accordance with their contract with you, and that's separate between the county entity and WellPath.
Thanks. So basically nothing's changed, and I can let the fiscal people know that, nope, it's the way we've been setting it up. So that's good. Thank you.
Hey, Autumn, can I just jump in real quick on Seth's topic? This is Kathy with NAFCare, and Seth, that's exactly how I understand it as well, as the way Autumn described it. The only place that I would expect to see a NAFCare provider's NPI would be in the rendering or the other operating field on those UB forms.
Correct.
Can you just say that one more time?
The rendering provider would be like the type 1 NPI could be a WellPath practitioner, the rendering provider, but the billing entity,
sure, yeah, they would be,
NPI
yeah,
should be the correctional facility itself.
got it. Yeah,
Right.
that's just what I thought. Thank you, and thanks. I think Kathy. I think it was Kathy. Thank you.
Yes, thank you.
Molly?
Hi, I'm Molly Bacigalupo from Nevada County Sheriff's Office. I had a couple of questions. One of the questions that I had was regarding the PAVE portal and how long it's taking to get processed. As of right now, I think we're in the process of completing the application. But we're trying to figure out the controlling interest part and what to list. I know that we're supposed to be listed as managing employees, but who does that include? Does that include like, you know, me as the project manager, the lieutenants, the captains, the sheriff, the undersheriff, how to sort of navigate that, and then what's the turnaround time? And then I also have a question regarding the MOU and data sharing. Just how counties are handling sharing data between Department of Social Services as well as behavioral health linkages.
Okay, on the first question, I think we can ask somebody, or like we can get you some technical assistance support on the controlling interest. I do believe there's actually like guidance around that, but we can get you some support to answer the specific question about like what level and how far down into the organization do you need to go to list folks for that in terms of the Medi-Cal application. So make a note to follow up with you on that piece. In terms of the turnaround time, the guidance that we've given is that the correctional facility folks, you should submit your application at the same time that you submit your readiness review. And then while we're reviewing the readiness review documents, the provider enrollment team would be reviewing your application, and they would like basically activate your Medi-Cal enrollment upon notification from our team that you meet the requirements for readiness or that you've been approved to go live. So, and we're adjusting, right? So for this first cohort, unfortunately for Yuba, Santa Clara, and Inyo, we had some things happening with CMS that delayed our notification to the counties. We've now gotten that, so we'll shore up our internal timelines to make sure that that's all happening well in advance of the actual go live. But basically, it would like you would be entered into the provider master file as an eligible provider to coincide with your go live date. So from a turnaround time perspective, it's you submit it at the time of your readiness, and then it'll be activated by the time you're approved to go live.
And I'm just trying to understand how the PAVE portal is going to be different than the JI portal that has not been released.
Go ahead, sorry.
No, I think I'm just a bit confused on which one we should be using. Are they both? Because it kind of sounds like the PAVE portal will be obsolete once the JI screening portal is released.
So they serve different functions. So PAVE is our enrollment system. It's a provider application, verification, something. And that's how Medi-Cal providers enroll in our Medi-Cal program. So that's a one-time correctional facility submits your PAVE application to be activated as an exempt from licensure clinic. Before you do that, you get your NPI number, then you go through and you enroll through PAVE, you fill out all of the paperwork like you were talking about around managing partner, or, you know, agent, then all of that, right? And then submit that. Once you're enrolled, then you're enrolled. There's some like annual re-enrollment and verification processes, or triennial. I'm not sure what the timeline actually is, but that's like you're already in the system. So you don't do things through PAVE necessarily. You'll start to get notifications from our Medi-Cal provider portal. You'll start, you know, because you'll be an active Medi-Cal member. Now the JI screening portal is really member facing. So the PAVE is entity organizational facing for providers to become Medi-Cal providers. The JI portal is around the member eligibility, not the organizational eligibility. So it's around activating the member aid code so that their benefit is turned on during that pre-release period. And you also put in information about what deems them eligible in terms of the screening criteria. So if they have a mental illness or substance use disorder or chronic health condition, you would indicate that in the JI screening portal. Or if they're a youth and they don't have to meet any of those requirements, then that's what determines that this is a Medi-Cal member that is getting pre-release services or is eligible for pre-release services. So it's two different types of systems. One of them's for the correctional facility, so for the sheriff's office. One of them is for you to be able to activate each member so that they can get, so that you can get reimbursement for services that are provided to those Medi-Cal members. Does that make sense? Anything our team wants to add on to anything I just said? Good, thumbs ups all around. Okay, great. Thanks for your question. I think that's helpful. We did also kind of present, Molly, one more thing. I don't know if you were part of our kickoff session in August. We can send around those decks, but in that we kind of link to the documents that show you exactly what the enrollment process looks like in PAVE. And then there was a training on the JI screening portals that happened in September. Those trainings are available on our Medi-Cal learning portal, and we can drop the chat for everybody in the chat so that folks have that access to where to find that.
Yeah.
Okay, Sharon Post. Oh, I'm sorry, but for Sharon, before we get to you, Molly, I forgot to circle back on your question around the MOU and data sharing piece. So we are, there is CalAIM data sharing authorization guidance that we can also link in the chat. There will be a reentry toolkit that we're going to put out to supplement that data sharing authorization guidance. There's also some guidance in our policy and operations guide around the data sharing requirements and responsibilities. So we'll make sure to share out all of that information as well. But yes, there should be, agreements in place to facilitate data sharing. There's also some coverage in terms of HIPAA covered entities once you're an enrolled Medi-Cal provider. But we have all of these kind of considerations laid out in our guidance. So we'll share that with you in the chat as well. Sharon?
Hi, so I'm with Sonoma County Sheriff's Office, excuse me. And I had a question about the portal, the JI portal. And I'm wondering if the recommendation is that be an eligibility specialist who is performing all the tasks to activate people and, or whether that's something that somebody from operations in the corrections facility can do. I don't have a good sense of how much of an expert the person needs to be on Medi-Cal, or whether it's, simplified for somebody who's not been trained as an eligibility specialist.
I think that, again, team, feel free to jump in if you don't agree with what I'm about to say, but I think that pretty much any of your admin folks could put the information, as long as they're taking, information from like the screening that's happened and they're doing, doing the data entry part of it. It should be pretty intuitive in terms of how to input the information, or pretty basic questions around like what makes the person eligible. So there is some training available on the portal. We just put the link to it in the chat, but then I don't think you necessarily need an eligibility specialist. Where you need an eligibility specialist is kind of in that pre-release Medi-Cal application process and working with the county social services department. But once they're deemed eligible for Medi-Cal, which is what your eligibility specialist would do, then the next step is making sure that they meet the healthcare criteria for pre-release services. If they're an adult, if they're a youth, they automatically, and then just entering that information. So it's like their name, date of birth, their Medi-Cal SIN number, what are the healthcare criteria that qualify them for pre-release services, and the release date. There might be some other kind of basic information, but it's not it's not really like an eligibility determination. It's just putting that in after the eligibility determination's already been made, helps us know to turn on the aid code that makes them then eligible, makes you eligible for reimbursement for that member.
Okay.
Again, if any of my folks want to add to or clarify anything I said, please jump in, but.
Hi, this is Ashley Deli, and I just wanted to add to the designee who will be entering that information into the JI screening portal. You'll want to make sure that it's clearly communicated how that member meets the healthcare criteria for that, because there will be an option in there to select which healthcare criteria they meet for the program. But it's pretty self-explanatory, the screens to the JI screening portal, and very user-friendly.
Okay. And another kind of related question, we have a system set up now with Human Services where we are providing incarceration dates and release dates as best we can on a regular basis for Human Services. And so when this portal goes active and when we go live and start using this, is it assumed then that we will not be required to get that data to Human Services all the time? Is that just a temporary mandate at this point until we are using the portal? Because if we are then entering release dates on our own, does that become redundant then at that point?
I mean, I think the point of notifying the county social services department that the individual has been released is so that they can activate or deactivate the JI aid code and kind of activate their regular full scope Medi-Cal benefits. So that's why there's that kind of connection that needs to be made back to the county social services department, so that way there's no gap in care for them once the member is released into the community.
Okay. And then my final question was, is it a problem if we have two different providers kind of splitting a bundle? I understand for billing, you know, we have one provider who will be doing initial screenings when people come into the facility, and then they'll be referred to County Behavioral Health, who will be continuing then the process of additional screening. And so if those fall into the same bundles, is that an issue if we have different providers splitting a bundle?
We've talked about kind of a mixed care management bundle that would allow those responsibilities to be shared in the way that you're talking about. I think, you know, we're planning to present out on that in our learning session around enhanced care management and the warm handoff to provide more information, so a little bit more of a deep dive. But we do have some scenarios put together around like the mixed care management model and what that would look like, and many of the bundles can be billed more than once. So like one, you know, your embedded case manager would bill the bundle for whatever activities they're doing, and then the in-reach provider who's also sharing some of those care management responsibilities can also bill for the activities that they're responsible for.
Thank you.
You're welcome. Let's see, I know we have some questions in the Q&A. We're trying to answer those as we go, but and I think some of these have already been addressed. So there's a question about, you know, putting the link to the slides for session 2 in the chat. I think we can, we have the learning session 2 recording posted and in the chats now. So that one's been answered. There's a question from Tariq Qureshi around when restarting pre-release services in the JI portal due to a pause, do we proceed to restart services or do we need to reset? The JI portal guide says that one reset must occur before a restart. We did give in that learning session 2 some scenarios around the pause and reset scenarios to kind of further try to eliminate that. Let me see if I can pull up the slides for that real quick. See, I can show you instead of trying to go off of memory. Just a second. Maybe we'll come back around on that while we look for the documents. But we did kind of put out some scenarios on the pause and restart, which I think contemplates what you're talking about there. So I'll look for that and share. Polo Ortiz. Hand was up, now it's down, and you're gone.
Sorry, no, I'm here.
There
But
you go. Okay.
I did cut in front of Victoria, so I'm gonna defer to Victoria.
Oh, I didn't see Victoria's hand. Sorry about that.
That's okay. Go ahead, Victoria.
Thank you, I appreciate that. I had a question that we are encountering is the court is ordering an assessment for an individual and he is not gonna have a release date until the assessment is completed and reviewed by the judge in the court. So we
Yeah.
have encountered, this is what we have foreseen and we're already encountering this issue, is they get a release date based on their assessment of the outcome of the assessment. So they'll get released like the end of the week, or they'll get released, they'll provide a release date when bed becomes available for someone that is in need of residential treatment.
I would maybe think about the portal as less static than that, right? So you start off, you can activate the aid code without entering the release date information. So you enter it if the release date is known. Otherwise, you can not enter a specific release date if it's unknown. But then once you do know the release date, then you go back in and add it into the portal for that member. And so it's not like you just do one time and then you're good to go, but like as information changes, you should update the portal with the most accurate and timely information that you have for the member. And the intention and the purpose for the JI screening portal is really to track the 90-day period. So it's like, how do we make sure that we can comply with the federal requirements about limiting the services to that 90-day period? So if you activate the aid code, for example, on a Monday, and then the judge orders the assessment during that week, you do the assessment, go back to court on Friday, the judge then makes a decision, like maybe they go home then, or maybe they are going to be incarcerated for a longer period, then you can update the portal with that information once the release date is known, even if like then even if they got released from the court, by the way. But yeah.
Oh, fabulous. Thank you so much.
Yeah. Then if I ever say anything that my team doesn't agree with, please jump in. Okay, not hearing any of those. That's good. All right, then Polo, I think you were next.
Yes, thank you, Autumn. So one of the questions that's come up is from our in-reach providers who bill specialty mental health services. Am I echoing?
I think you're okay. Go ahead.
Okay, sorry, it was echoing on my end. Sorry. Is what kind of guidance is there for why a in-reach provider is billing short Doyle versus specialty mental health services, and how we can help our specialty mental health service providers or our drug treatment providers understand the billing sequence of short Doyle.
Yeah, the services, pre-release services in large part are actually not billed through the short Doyle system. Only the county.
Yeah, sorry, I meant to say when it comes to behavioral health linkages such as worm handoffs.
Yeah,
Sorry.
so it's the only service that can be billed to short Doyle is the counties receiving the link. All of the other services, in-reach clinical consultation, the care management, like all of those services are billed through our fee-for-service delivery system, and our county behavioral health agencies will need to enroll, or their providers will need to enroll as fee-for-service providers in our fee-for-service delivery system and submit those claims through our CAMIS delivery system. It's only the county entity receiving the link is the only thing that they can bill through Short Doyle. We do have guidance about that out, but and we talked about it in the learning session last week, but can reiterate that with the county behavioral health agencies as well.
Yeah, if you could just point me in that direction or the guidance, I appreciate it. Thank you.
Sure thing.
Autumn, I just wanted to add too, I believe there are a few slides in as part of today's office hours that speak a little bit more about Short Doyle.
Yeah, and that's linked in the chat. So if you can grab that PDF out of the chat, it'll have some of those FAQs related to that issue there. Heather.
Hi, I am just going to touch on the Short Doyle piece because you just clarified in an email back to us, and I just want to make sure because I think some of my partners are on here. Unless the county behavioral health is embedded, if we are an embedded provider, we do not have to bill through CAMIS nor register in PAVE because we are only receiving, and by receiving, we will be billing Short Doyle. Our services provided are embedded, and that will be billed through CAMIS by the correctional facility, correct?
Correct. If you are, as a county behavioral health agency, if you are under contract with a correctional facility to operate as an embedded provider, the claims will go through the correctional facility's NPI number and be billed by the correctional facility, and they will pay you in accordance with their contract with you. So that is correct. If you're embedded, then you don't need to enroll in fee-for-service and submit claims directly to CAMIS because the correctional facility will do that. It's a good clarification. Victoria.
A question just popped up in my mind. So we've been working with the county jail with the CalAIM Justice Involved Initiative. We're waiting to go live. Our readiness assessment is still pending approval from DHCS. However, we also have juvenile hall, and according to the policy guide, behavioral health needs to provide those pre-release service regardless if juvenile hall is ready or not. They're gonna wait till 2026 to do those pre-release services for the juveniles. But for us, since we're gonna still provide those services, are we have to be responsible working with DHCS to put that JI code?
Which entity are you with? Sorry, Victoria.
Imperial County Behavioral Health.
So you're with Imperial County Behavioral Health?
Yeah, so I've been working with the sheriff's office for quite some time for this initiative, and the corrections and the jail corrections is working with DSS to put the JI code. We don't have to worry about that. We do our part with the assessment and care coordination and the warm handoffs. However, juvenile hall, juvenile hall is not ready, and they won't be ready until 2026, but we're supposed to provide those services regardless. So I'm wondering, do we have to work with DSS to make sure we put that JIA code in?
So that was the question that we got asked kind of at the top of the call around like
sorry about that.
That's okay. What if the county correctional facility is not live yet in terms of like, can the county behavioral health agency still submit claims for reimbursement? And it kind of goes back to that whole issue of activating the A code, which I hear you're asking, like, is there another way to do that? Right now there's not, but we'll take that back, like I said earlier, and provide additional guidance there.
Okay, thank you. I appreciate that. Sorry, I joined a little late, so I apologize for asking.
Oh, no problem. Yeah, no problem. Okay, we just have a couple minutes left. I'm not seeing, I know that there's questions still in the chat. We will, anything that, I think most of these were answered live in our discussion. We'll make sure that we're answering all of the questions in the follow-up like we've been doing with the FAQs, add those. But like I said, I think most of these have already been addressed. There is a question about from Esther or Lana of if the correctional facilities will get added to the master provider file. Yes, upon enrollment as an exempt from licensure clinic, the correctional facility will be listed in the provider master file as an exempt from licensure clinic. So that one is a yes. And then there's a question about how PAVE will work for the county behavioral health agencies. Do you use an existing PAVE or do you need something different? I will say for the county behavioral health agencies and BH providers that are not currently enrolled and there's not a current enrollment pathway, we're actually working on that. So we don't have a pathway established just yet. But we're working on that in the background and we'll give additional guidance to counties. In the meantime, services can still continue, but we have to resolve some system issues around the enrollment pathway for county behavioral health agencies. So more information coming soon about that one. I think that's most of the questions. Question about if there are youth who are currently housed, detained, or committed in our juvenile justice campus facility who are over the age of 18 but not former foster youth eligible for CalAIM services. Are they eligible for services automatically? I think what we've said about that, I'm just pulling up the exact language, is that it's youth. If they're housed in the youth correctional facility, then they're eligible for the services up to the age of 21, so under 21. But folks, anybody want to correct my understanding as I'm pulling up the language? Or former foster youth under the age of 26. But if they're not foster youth, up to the age of 21 if they're housed in the juvenile facility. Okay, we'll clarify that in writing, but I believe that to be the answer. Not seeing anybody jump in. So we will yeah, we'll follow up on that one. Okay, that kind of brings us to time for today. Tried to answer as many of the questions as we could. I know there's a couple in writing that we didn't get to, but just called out most of those in the last couple of minutes. Thank you all for joining today. Thank you for doing this hard work with us. We appreciate your efforts. Hopefully these sessions are useful and you're all getting something out of them. We'll continue to do them. Also thank you to all of you who saved this space for our county partners. Next week, we'll have a general office hours for anybody to ask your questions, including our plan partners. Feel free to come and ask your questions next week. We just want to make sure that our county partners are getting the time that they need to get questions addressed so that we can lift up these programs across the state. Appreciate your ongoing partnership. Our next learning session will be coming up, focused on clinical, physical health clinical services. Last time we did the behavioral health, but this time we'll focus on physical health, non-behavioral health services. So that's coming up pretty soon, and the date for that is October 17th. So looking forward to that. The registration link is in the chat. And we'll see you next week. Oh, Dee Dee, you have your hand up?
Yeah, I'm sorry. I
hear you, Dee Dee, you're breaking up.
Did I get the name of the person?
Can't hear you. All right, well, sorry, Dee Dee. Couldn't hear what you were saying. She's going to drop it in the chat, so we'll leave the meeting open for just a moment so we can make sure folks get the information Dee Dee's trying to share. But thank you all for joining us. Hang on to hear the last update from Dee Dee McKesson, who's with our CAMUS Operations Division. So probably an important message. And we'll see you next time. Thank you.